Good morning, John Schafer. Dr. John Schafer is with us this morning on Cheers to Your Health. And Dr. Schafer is a neurologist, and I have known him for almost 45 years. He was a marvelous volunteer for the American Heart Association. And we wanted to talk a little bit this morning, John, about why you chose neurology as your focus area, and also some of the diseases that fall under neurology and some of your really creative ideas at addressing and helping people that have MS and other neurological disorders. So welcome, and we're thrilled to have you here. And please tell me where you went to school, where you were born, and how things unfolded.
Well, thank you, Diane. This is an amazing project that you're involved in, and those questions that you just asked. Do we have like 4 or 5 hours to?
We can extend, exactly. We might have a few days.
So you're right. Yeah, you and I have known each other for a very long time, and in fact, you're responsible for much of my career and where it ended up. I just retired, in fact, a month ago, and so it has been after a long career. I grew up in Wisconsin and Illinois, and I went to medical school at the University of Chicago, and I did some medicine internship and residency there. And then I came to San Francisco for my neurology training, and after 3 years at UCSF for neurology, spent 2 years in the Navy at the Oakland Naval Hospital, and then came to Sacramento after that. And have been in practice in Sacramento since that time, up until a month ago. And how did you asked me prior to this? So how did I pick neurology? And I think that, even when I was in high school and I was doing science projects, it involved nerve transmission and muscle contraction and things, and which is kind of related to neurology. And I think it's really difficult for, why did anyone pick a particular specialty? I've always been amazed at specialties that people pick and wondered why they would ever be interested in something like that. But neurology is fascinating, how the brain works and the spinal cord and the nerves and is extremely mysterious. And there's still so much that we don't understand about brain function. So it certainly is a challenge. There are many disorders that affect the way the brain and the nervous system work. And you mentioned, what kinds of disorders are there? There's a myriad of disorders ranging from problems in which the nervous system doesn't develop properly when the organism is being formed, to paroxysmal things, that is, sudden things that happen during the course of one's life, things like strokes, where a blood clot can suddenly block off, an important part of the brain, or trauma, certainly. And then there's a range of conditions that are caused by inflammation, and of common one of those is multiple sclerosis, in which the immune system attacks the insulating material on the nerves in the brain and in the spinal cord. And then, of course, there's trauma. Head injuries and spinal cord injuries are an important type of disability that we see today. And then finally, in later stages of life, there's a whole group of neurologic disorders that are referred to as degenerative disorders, which is just parts of the brain, getting too old or not working properly. And those include things like Parkinson's disease and Alzheimer's disease and a variety of others. So it is something that covers the whole lifespan, and all of these, as I say, are part of the mysteries of how the brain works.
Right, exactly. I've been kind of looking at neurological diseases and frankly, partially because I've known you. And so I've been kind of like looking out there. And then a member of my own family was diagnosed with MS, and you were extremely helpful. One of the things I'm wondering is, it seems to me that neurological disorders seem to hit women the hardest, and also women of Celt background, or women in the northern areas of the globe, like England, Ireland, the Scandinavian countries. Is that true?
Well, what you're saying is true of multiple sclerosis. It's not true of neurologic disorders in general. Parkinson's disease and Alzheimer's disease have different predilections, but multiple sclerosis is there's 3 or 4 times as many women as men who are afflicted with multiple sclerosis, and it is something that of Northern European and Scandinavian heritage have a higher risk of developing multiple sclerosis, and probably for a lot of reasons, right. Genes being one of those.
Right. Yeah, I've heard that, like, even if you have just a kind of a little bit of maybe Latin blood, Italian or French, or that you don't get it as often. And that was just an amazing thing to me, that it is kind of geographically focused.
Yeah. To an extent, that's true. Multiple sclerosis is not generally considered to be a genetic disorder. When we talk about genetic disorders, we usually talk about things like Huntington's disease, for example, where there is a gene. And if you have that gene, then you have Huntington's disease. And if you don't have that gene, you don't have Huntington's disease. And many disorders that we know of today are multi genetic, and that there are many, many genes, and multiple sclerosis is one of those, that there's over 200 genes that are more common in a group of people with MS than in the general population, but not enough that you could say that any one of those is the cause of MS. But so I think that that's where a lot of the ethnic issues come in.
Yeah. That's been kind of a surprise for me. I've watched your career too in Northern California, and have noticed that, wherever you are, John, you seem to be doing something to help, especially people with MS. Could you talk a little bit about the programs, some of the programs that you've started that are continuing?
Well, I think that, neurology has become subspecialized. When I finished my residency, which was in the 1970s, I felt like I was an expert on everything neurological, whether it's migraine headaches or pinched nerves or Alzheimer's disease or Parkinson's disease. And through the years, there have been so many developments and new treatments and new ways of diagnosing all of these things that now many of us end up specializing in one particular area. And my interests have been, well, you got me interested in stroke years ago through when you were with the American Heart Association, and then more recently it's been multiple sclerosis. But so I started the Multiple Sclerosis Center with Mercy Medical Group, Dignity Health here in Sacramento in about 2009, and it wasn't that we suddenly started. I mean, we'd always been doing that, but we sort of christened that as a center and developed then resources to support that. Nurses to help who were specially trained in MS, and educational programs. And then I was very fortunate to have been approached by the Conrad Hilton Foundation, or a person working with the Conrad Hilton Foundation in 2013, actually, and asked whether I would be interested in applying for a grant for a wellness program, such as one that Conrad Hilton Foundation had been supporting at UCLA for quite a few years. And I said yes, and we got a very generous grant to get started, and then some additional grants to keep it going. But so in 2014, the Multiple Sclerosis Achievement Center opened, and it consists of a weekly program for people with disability from multiple sclerosis, and it's a 5-hour program. And 1 day a week that includes physical and cognitive and social and activities, and it's the social aspect of it is absolutely amazing. I mean, it's a uncommon enough disorder that many people with MS don't know anybody else with MS, and also it affects young people and middle-aged people and visible impairment. So when they're out in public, they have to. One of the things people say when they come to this program is, I can come here and I don't have to explain anything to anybody. Why I talk funny, or why I walk funny, or why I don't think as fast as I should.
Right. Yeah, I can see that program would be absolutely marvelous for people who are suffering from MS. So is it like a daily program? Do they go daily?
So the core program is 1 day a week for 5 hours. Now, this is pre-pandemic. It's been modified during the pandemic, and so it's a kind of a hybrid of virtual and in person. But the full original program is 5 hours on 1 day a week, and actually, there's one of the days has 2 shorter programs that kind of overlap for people that would not be physically able to tolerate a full 5 hours. So it's every week, but the connections that are made go every day. That people
Exactly.
are in contact with each other and form friendships outside of the group. There's also a support partners program, and that's such an important thing. Multiple sclerosis affects not just the person who has it, but their whole family and their relationships. And so there's an ongoing program for the families of people who have MS. And so lots of activities. There's about 100 people who are in the core program, and then in outreach programs. And then there's also the MS Center itself has a every other month lecture series for the general public and for people with MS on aspects of MS. So a lot of activities.
And the service that you are providing for these people, it's marvelous. We're going to take a little break now, and we will be back with Dr. John Schafer talking about aspects of neurology on Cheers to Your Health. We're back with Dr. John Schafer, and now we're going to talk a little bit about Alzheimer's disease, because we know a lot of people are dealing with family members and friends that have Alzheimer's. So, John, do you have any tips for people who have family members, who have friends who are dealing with Alzheimer's?
So Alzheimer's is a huge problem, and it's going to become even more huge as the population ages. And it's really something that people are unprepared for. That is, families are unprepared for as a family member develops Alzheimer's disease. It comes on very slowly. It extends over a period of years, and family members may feel totally helpless when they experience this, not knowing what's going to happen. And there is enough variability from one person to another that it is often hard to predict just how long is this going to go on and where's it going to end up. My advice to everybody is that there are services that are available. There are associations, the Alzheimer's Society and the Del Oro Caregivers Center are some examples of organizations, and then there's support groups and things that I think are really, really important for people to participate in, just so that they get a better idea. When I have patients with Alzheimer's, I have in some cases connected family members from one patient and another patient to where I can see their similarities in the patient that it may be helpful to link with somebody else that's been through it. Everybody's looking for a cure to Alzheimer's or a prevention, and so far, we don't have it. We all read in the newspaper about exciting things that are happening, and there may be some inroads in the coming years, but I think that even those are going to be modest. Part of the problem is that the Alzheimer's process begins long before you even know that it's happening. And so with clinical trials of medications, they take people who have Alzheimer's disease and give them a medicine and see if it changes them, and it doesn't. But, perhaps we need to be taking those medications when somebody's in their 20s or their 30s before the process has even started, to see whether they actually have any long-term effect. And so that's, but I think getting support is just so hugely important, because it's a very, very rough road.
I would think you'd feel isolated, with a family member and not having dealt with Alzheimer's before, that it would really have some challenges. And so anything that is helpful to people that are dealing with this, I think is good to know. How about things like how you kind of interact with a person that has Alzheimer's? I've heard various things. One thing I've heard is that you should not ask them a lot of questions. That do you remember questions? Have you heard that?
It's hard to generalize about that. People react very differently. A lot of individuals with Alzheimer's don't believe that there's anything wrong with them, and it's the family member who's saying, "Hey, this is not the person I married. Something's wrong with mom or dad or whatever." Whereas the affected person has no recollection or no recognition of that. And so I think those people, when you're pushing them and poking them and testing them, even within the family, that they don't do well with that. Yeah. Of course, as a neurologist, I have to do that. I have to ask them questions and go through mental status examinations and things, which for some people are very, very ignored. I remember, one of the mini mental status exam is a long-standing instrument for testing, because it gives you a score, and on the basis of that score, you can really characterize somebody. And one of them is, write a sentence. I tell you, just write a sentence. Anything that you want to, just write it down. And so one woman, handed me her paper, and it said, "Go to hell." And so that's how many people react to it. But and then I think that asking questions that a lot of times caregivers, especially children of parents who have Alzheimer's, may kind of overdo the testing, thinking that maybe they're helping things, that if I keep asking you, questions of orientation or memory, or that it will help you in some way, and it may not. On the other hand, people with Alzheimer's and other kinds of dementia, what they lose is the immediate memory. They can still remember where they went to third grade and who their junior high school teachers were, and so sometimes that's soothing to go back into the memories from years ago, when they can't remember what they had for breakfast an hour ago.
Exactly. Is that a general, could you say that that would be genuinely accurate, that people would remember the past much more than what they did yesterday?
Particularly in Alzheimer's disease. The problem is encoding new information in your brain. I've often explained to patients as, it's like you have a file cabinet, and here you have a file of information that you want to use sometime in the future. So you open up the drawer and you put it in there and you close the drawer, and then at some future time when you need it, you open up the drawer and you pull it out. And what's damaged in Alzheimer's is that process of putting it into the file cabinet. So stuff that's already in the file cabinet you can access, and that is the distant past memory. Whereas, as they say, what happened yesterday or what happened earlier today just didn't get put in the file cabinet, didn't get encoded in the memory.
Yeah, that's an excellent analogy. I mean, it really helps you understand what is relevant and what may be forgotten. Exactly. Do you have any further advice for people regarding neurological diseases? If there was anything generally that you could say to help people who are listening?
I think probably the most important thing is to maintain good general health. Many of the neurologic disorders, including dementia, Alzheimer's disease, and including things like multiple sclerosis, are worse if there's comorbidities. So if people are overweight, or if you have high blood pressure or diabetes, that really compounds things. And so, there is no diet for Alzheimer's. There's no diet for Parkinson's or for multiple sclerosis, but heart healthy diets. You, Diane, from your years with the American Heart Association, know that that heart healthy diets are good for the brain.
Yeah.
Exercise. Many studies have shown that exercise is good for the brain in all of these conditions, and so I think that those are very important things. Smoking is harmful to the brain, and it's best to not start at all. And for those who have started, to stop it, and hope that risk for strokes and heart attacks and multiple sclerosis, which is affected by smoking, can eventually subside.
Yeah. No, that's absolutely true. And in fact, I was just listening this morning to a program that said that for those who have suffered the hardest from COVID-19, they have been statistically 80% have been either overweight, obese, or never getting proper exercise. I mean, 80%. That's significant, So I agree with everything you say about taking care of your health all along the way. And I think that sometimes we don't have the advantages that some countries do as far as having to walk. I mean, it seems like other countries the people walk so much more than we do. We are very dependent on our vehicles. So if there are times, they say that the 50s are a great time to really practice good exercise habits, good eating habits. So, I mean, that can carry you on to your later years. Yeah.
At least till 55 or 60, right?
Exactly.
Maybe longer, right?
Shades of Doc Martin. Yeah.
Right.
Yeah.
Right.
Well, John Schafer, thank you so much for joining us today. And Community Radio would like to absolutely enhance and tell you that we have been very impressed with the work that you've been doing these many years. And we thank you for the service that you've given to Sacramentans, because it's been just fabulous. So, John Schafer, thank you. And we hope you will join us again. And maybe we will be talking about other topics.
Maybe. Be happy to, Diane. Thank you.